So to gain mobility throughout the foot and ankle, I mobilized the talus posteriorly, and we then had her on her stomach, but I'll just demonstrate in this position. Then I did traction to the calcaneus, and I mobilized it into lateral rotation, also called abduction, and that was significantly helpful in restoring all movements of mobility. To gain knee extension, I put a 2-inch fulcrum foam. I really like this foam because it gives a little bit, so it conforms to the shape of the body. And so it's tolerated very well, at which point it becomes rigid. And then we put 5-pound weights on each of her knees. And we only did that for 5 minutes. So as she tolerates that, she'll do it for longer periods of time and hopefully make additional gains. And I don't know if I demonstrated the rigidity. I don't think I did. Internal rotation had a hard end feel, and now the end feel is softer. And the way that we gained that mobility was we placed the foam fulcrum underneath her hip rotators on both sides. We did that for 5 minutes. Okay, on your stomach, please. To glide the sacrum forward and glide the hemipelvis back on both sides, we put foam under each side for 5 minutes. And after 5 minutes, then I came and just applied a pure PA glide at the sacrum, just matching the force that was there, which would probably be less than, somewhere between 15 and 30 pounds is the amount of force that I applied. And that was an additional 5 minutes. And that's what unlocked it. And now you can see I can spring the sacrum. I see her feet moving, so the force is going through the SI, down into the hips, down into the lower extremity. You know, just very good. I can take up the slack now, which I couldn't do before. Sacrotuberous ligament, I can now indent it, so it's not rock hard like bone. And there is no bone here, but that's what it felt like. I did a mobilization, an oblique mobilization to the shoulder girdle. And I usually just come up and cradle it like that. And I did that to both sides. And then put your face in this opening, please. And then I captured the shelf of the scapula and just loaded the whole body. So I loaded it to a natural end point and just stayed there. And let's have you on your back now. And then I came and I found the angle of your clavicle, and I hooked underneath. I folded my fingers and captured the scapula. And then I walked up the crease of the axilla onto the acromion, that bump right there, and I distracted the front of the scapula. So the back of the scapula was being tractioned towards me. My arm demonstrates that angle, about a 30-degree angle, which parallels the angle of your clavicle. So the back of it was distracted, and also the front of it was distracted. So we ended up gapping the AC joint and the SC joint, the acromioclavicular joint. Now we certainly have more room for progress. You demonstrated after that you're still a little tight here, not quite 180, and given your body type, I would expect you to have 180. So there's a little more work that we can do here. We certainly gained an internal rotation. Look at that. That's, 50, maybe 60 degrees. So that increased. So we have more work to do, but I think for day one, I think we're off to a really good start. Any last thoughts?
I'm excited to get movement back in my body.
Very good. So we'll start teaching you tomorrow the things that you can do yourself, and we'll also film those for you. And I like filming. I just feel like it's a little nicer than a handout of a Xerox picture,
Yeah, it helps me visual.
Nice. Good. Well, thank you very much.